Ron.
All right, Jason, and it's interesting because that last point of advice, talking about how to save people on the scene and know some basic skills, really brings us now to Dr. Michael Foreman. He's Chief of Trauma at Baylor Scott & White in Dallas, and we want to say welcome to you here this midday. And we will get to that in just a moment, how people can help people on the scene of a shooting like this. God forbid you should be a victim of one. But you see these numbers, over 500 injured, more than 50 dead, and as the head of trauma, what's your first thought on just the scale of it?
Well, my first thought obviously is thoughts and prayers to the victims, but also to those that are providing care for the victims. It's an extremely stressful process that we go through. We do it every day, but when you become inundated with patients like this, and it truly overwhelms not only the institutional abilities, but individual abilities as well. This is a very stressful process, and we all have them in our prayers.
Both the skill and the heartache of being in triage is that you have to make very, very critical decisions. A patient comes in and you have to decide, is this a patient that we can spend time on, or are they, for lack of a better term, simply too far gone, and then you move on to the next less critically injured patient. How difficult is that emotionally?
It's very difficult. Thankfully, it's not something that most of us in civilian practice have to deal with on a regular basis. Our goal is that we do everything for every patient.
But in this case, we know.
In this case, you don't have the option.
They had to make those critical decisions, did they not?
Almost certainly.
They have one level 1 trauma hospital in the Vegas area. The population is far less than it is in Dallas. We have 3 here in this community. Could our 3 facilities, for example, handle this number of casualties?
I don't think any facility can handle this number of casualties presented to them in this length of time. This would overwhelm the most robust military hospital to have 500 casualties arriving in a relatively short period of time. We are blessed by having a multitude of trauma centers, level 1s and level 2s in the region, but any one of us can become overwhelmed. It just takes one patient more than what you can deal with to get into a mass casualty situation.
And it takes a situation like this to get us thinking about how any large American city might handle a large-scale terrorist attack, which we know we are at risk of, and in this case, in risk of even somebody, a lone gunman, creating this amount of chaos and carnage. Let's talk, if we can, here for a moment about what Jason had addressed, and that is the ability to stop the bleeding as quickly as possible on the front end as a victim is waiting to either be carried by pedestrian vehicle or ambulance to a hospital. Is there a rate of survival if you're able to get that kind of contact on the front end?
Absolutely. The American College of Surgeons and a variety of other institutions have come together to actually create a program called Stop the Bleed, with the concept being that simply stopping hemorrhage from an extremity wound, for example, saves lives. You can save yourself, you can save others, and it's a great course. We teach it. There are a variety of different hospitals in the area that are teaching this course, and I would recommend it to anyone. And again, we all think about the shootings, but you know, you can trip and fall.
You can be with a friend.
Lacerate your leg, and we have seen patients who actually bleed to death. We can do all sorts of things when we get you, but if you're not alive when you get to us, then we've lost that opportunity. So stopping that hemorrhage, just a few simple life-saving steps that are available and can be taught to anyone and can be performed by anyone, saves lives.
Great to know. Mike Foreman, thank you for joining us from Baylor Scott & White. We appreciate it.